So hello and welcome back to this video lecture, and we are going to discuss this as continuation of our series of videos on communicable and infectious diseases. And this disease is common, and I think maybe some, if not most, if not all of you have experienced this already, and you have an experience of this. You have a maybe memorable experience of this, and I know there's a mark in you that it left. I'm talking about varicella or chicken pox, or in Filipino we call it pulutong. Okay. So varicella or chicken pox is an acute and highly contagious disease. It is characterized by vesicular eruptions. So compared to others who or which are macules, papules, this one is vesicles. Okay, so it has fluid inside, and usually it affects the skin and other mucous membranes. The etiologic agent is varicella virus, and it's a filterable virus, varicella zoster virus. A mode of entry is air droplets from nasopharyngeal secretions in, or in other words, respiratory route. And man is the only source of infection. Man is only reservoir of this infection. Okay, showing you some images related to chickenpox or varicella. Okay, there you go. That's the rashes. I think it's starting to die up. Okay, of course the system is integumentary. The system affected is integumentary, respiratory, almost all of the systems. So primarily it's respiratory and also skin, integumentary. Incubation period from one reference is 10 to 30 days, although again other references would say other duration, other numbers. Modes of transmission: direct contact with person who sheds the virus from the vesicles, indirect through linens or fomites, and airborne droplets. So this is coming from different sources also. Period of communicability, meaning you're capable of transmitting it to others. 1 day before the eruption of rashes, and to the 5th day or 6th day before the last scab formation, or in other words, until all vesicles have become encrusted or all vesicles have dried up. Okay, so there's a period of communicability for varicella. Uh, again, the manifestations are divided into stages. First, the pre-eruptive phase, fever, headache, body malaise, muscle pain, and usually symptoms can occur within 24 hours after exposure. Then, eruptive phase, rashes appear in centrifugal pattern, sorry, which is described as vesiculopustular or vesiculopapular rash, and it's more abundant in the covered areas of the body. Okay, and when you say centrifugal in appearance, it usually starts on the center and spreads outward. Okay, usually it starts in the chest, abdomen, or the back, then spreads outside the rest of the body from the center going to the periphery. So yes, it starts in the trunk, the covered areas first. Usually the initial lesions are red papules, and vesicular lesions are also pruritic, so it's really itchy. And although we are advised not to scratch it, or you wear gloves, okay, mittens, to avoid scratching it, to avoid destroying further the skin integrity, being destroyed or damaged by the rashes. And as I mentioned, is maculopapular or pustular rash. It starts with macule, then papule, then vesicle, then pustule, then it encrasses. Okay. Usually, this rashes leaves a scar, and the scar usually can be lifetime. That's why I was mentioning this leaves a mark. Okay, and I know you have experience of it, and some of you can still locate where the marks of this or mark of this chickenpox is in your body. Then, speaking of the causative agents, usually there are cases that it becomes dormant or it lives inside your body. It doesn't go full blown disease. And what is to emphasize here, after you have chickenpox, though you are going to be immune, there is a sequela, okay, or continuation, or a disease going to happen after the dormant virus have been reactivated, and you call this shingles, okay, or herpes zoster disease, or but about the herpes zoster virus. Post-eruptive phase, lesions start to crust, leaving a scar that is superficial, depigmented, and take years to fade. Diagnostics is usually really clinical in nature, but seeing the type of or the appearance of the rashes, you can the examiner can, okay, or may diagnose it as chickenpox. But it has other tests also, like culture of the vesicular fluid, to know the definitive, okay, diagnostic test. Then medical treatment, there's a drug of choice here, which is acyclovir, the first one. Acyclovir, usually this is 800 milligrams 3 times a day for 5 days. Okay, 800 milligrams 3 times for 3 times a day for 5 days. So antihistamine is also one. Then antipyretic for fever, antihistamines for the itchiness. And for itchiness, you can apply lotion. Do not use other substances. Even corticosteroids is not acceptable here. It's only calamine lotion for soothing effect to stop minimum just temporarily the itchiness. Um, the child, if it's a child, should avoid it also, and they are taught to be wearing gloves. Okay, to wear gloves. Aspirin is not to be given because this will lead to another complication, which is rice disease. Um, cut fingers, fingernails, sorry, cut fingernails short, wash hands, wear mittens or gloves, then sensitivity to light because of the with possible conjunctivitis or irritation. Um, dim room. The patient should be in a dim room. Complications, we have fear, okay, bronchopneumonia, and Royce syndrome. Okay. Then last slide, we have preventive measures. The patient may go for immunization, uh, measles vaccine or MMR can do. Then we have also respiratory precautions, and teaching the patient to prevent also complications, or if not the patient, the significant others of the patient. So there you go. A simple presentation of discussing to discuss actually measles. And I hope you learned something in this video lecture series on this playlist. For the meantime, this will be the content of this video lecture series, and I hope to add up with other communicable diseases, and I'll be focusing also to other subjects. So just continue to subscribe and like and share. And thank you also for choosing nursing, because we really need more and more healthcare providers right now. And I know the right time you'll be serving community, the country, or abroad. Okay, and hope and pray for you to be more successful in life and to have good health, strength, protection, and wisdom as you go on through your lives, and health and safety also for your parents. Okay, so again, this is Sir Emil, your Sir One, your online nursing educator. Thank you. See you later. God bless.